So immunotherapy is an evolving field in oncology, and a very exciting one at that. And I'm glad that it's finally making its way into MPNs. We talked about the CALR directed or mutant CALR directed antibody, which is not quite immunotherapy, but targeted therapy, kind of an overlapping ish cousin. But it has shown some nice early clinical data and safety in ET patients. We'll learn more about the ET data and hopefully more about the myelofibrosis data at ASH. We next talked about T cell redirecting antibodies, so more like BiTEs or T cell engagers, where you're bringing the mutant CALR on one end and the T cells on the other end to bring them in close proximity so that the T cells can kill the mutant cells. And that's ongoing in a clinical trial with the J&J BiTE, and a phase 1 clinical trial with Insight that is that's on its way to open. We talked about CAR-Ts and MPN. So in Europe at University College London, they're exploring the possibility of mutant CALR-directed CAR-T, which was presented last year as a concept. And we'll see how the clinical responses and safety pan out there. We're working on a SLAMF7-directed CAR-T. As you know, elotuzumab was a naked antibody that was targeting SLAMF7, explored in myelofibrosis. With some efficacy, but obviously with the CAR-T, you'll be hitting it stronger. You'll be hitting it with the downstream T cell activation. And lastly, most importantly, about transplant and relapse prevention post-transplant, that's this place where you can harness the donor immune system, which is healthy T cells, which you can activate or engineer to target recipient leukemic stem cells or recipient hematopoietic stem cells in a post-transplant period, so that they can be targeted, and any residual recipient stem cells can be cleared off. So those are the things we talked about. They are a lot of these are concepts. A lot of these we need a much longer follow-up to understand how they eventually impact the field. Exciting nevertheless.